So from your perspective, since you've had all this experience of helping really launch all of these wonderful service lines at Avel, what have you seen is one of the biggest challenges from both a rural perspective and a tertiary hospital perspective?
Yeah, I think there's a lot of change hitting the health system right now. We're looking at that One Big Beautiful Bill Act as a huge opportunity for $5 billion worth of rural healthcare transformation. At the same time, facing some Medicaid cuts and a lot of pressure on insurance companies that we've got to keep the cost of healthcare down.
Yeah.
And I think we all feel that. It's a huge part of our national spending. It's a huge part of our personal spending. And we want these innovations, right? We want these new drugs and procedures. We want to extend our life, but it comes at this tremendous cost.
Yes.
So how do you keep bringing in these life-changing medications and surgeries and technology and robots at the same time, like keeping the cost reasonable? So you're balancing this huge equation.
Yeah.
And I don't envy healthcare leaders that are having to make those difficult decisions. When you look at a healthcare budget, though, the vast majority of our spend is still on our people, which is important. It's on our clinicians, it's on the support staff behind them, it's on the administrative team, but it is people driven. Yeah. And so when I think about challenges, you come back to that workforce. And unfortunately, because of COVID, we've had, we still have these ripple effects. There were lots of departures from healthcare. There was burnout. There was, fear maybe early on. Some early retirements or people leaving the field completely. You've had this shift in a quite a bit expansion in the advanced practice providers like nurse practitioners and physician assistants and trying to step into their role and state revisions around independent practice and things like that. So it's a lot of change coming at the same time. You have, trying to optimize EMRs still and trying to figure out what does AI mean and how is it an ROI that we can show for our facility? Is it what are the risks? What are the benefits?
Yes.
You've got a lot of medication supply costs that you're trying to keep down. And it's, there's just so many things to continue to look at improvement. And when you look at, especially in rural healthcare, margins are tight. And so to make a mistake is so costly. There's just not enough room to do some of this experimentation. You are one retirement, one accident away from losing your provider. That's that huge economic driver for your community. And so you're always kind of on that razor's edge. And yet you look out there and you think, gosh, what could AI integration into my billing operation do for me? But do I have the team that can implement it on top of everything else that they're doing right now?
Yes.
And so I'm sure that's not different from any other industry in a lot of ways, but healthcare has that special challenge that, we're dealing with, patient health, patient lives. And so we can't afford to make too many errors on the any errors really on the AI side, and we can't afford to put our clinicians in the back seat behind some of these technology changes, and so you've got to advance it all at once.
All at once, yeah.
And so I think the pace of change can feel slow, and I think you can see these big operators come in and think, I can solve this challenge, if it's Amazon and Walmart. And in some ways, I certainly hope so. But I also know at the end of the day, it's going to come back to these people in this workforce. And so that, to me, is still the number one challenge. There's just never going to be enough physicians, enough specialists when and where we need them. We're never going to have enough nurses to do all the heavy lifting we want. We're never going to have the pharmacists optimized to take care and review all the medications and do all the counseling that we would like them to. And so it's really how do you stretch everybody and kind of use technology then to bridge some of those gaps in the meantime.
Yeah. So when you're looking at these challenges throughout the years, have you seen this workforce challenge throughout, from the beginning, starting in 1993 with rural healthcare to looking at COVID, and finally the blinders came off of people realizing telemedicine can play a role into the field, even though we've been doing it for several years, and to now almost going back to helping rural health facilities with this rural health transformation initiative. Do you feel like the challenges have really remained the same throughout the years, or have they shifted a little bit?
I do think that the challenges over time seem to be getting greater. Yeah. And I wish I knew if the data actually back that up. Yeah. But it seems like the workforce shortages are becoming more acute. And you see that not only in the availability of people, but then the cost to recruit and retain individuals into your community. So those challenges do seem to be getting bigger. And I think that the amount of healthcare we're probably needing as a nation is getting greater as well. We've got a population that's aging, and as we age, our bodies need more and more tending to, and so that means more specialty appointments.
Yep.
I think what we see too is that when you get into that a part of life where you're needing multiple specialists, the care that you're receiving is so complex. And you can be kind of bounced around, and if you're hospitalized, you've got many medications that you're coming in on, many conditions for people to understand and support you with. And so I do feel like the problem is getting harder. Yeah. At the same time, we've had huge advances in lots of care, and so things like hip surgeries, are the people in the hospital are much sicker than they used to be, because anything that's been kind of optimized now is an outpatient procedure, or
you're going home the same day,
a one night stay. And so these nurses are still maybe dealing for maybe a similar number of patients, but they have more needs. And especially what we saw during COVID is really stretching, like how far can we have our staff cover this census. And I don't know that the census in hospitals has really gone down since then. It feels like many of the hospitals we work with are just bursting at the seams. They're looking for ways to, keep lower acuity patients out in maybe rural facilities or community hospitals. Those community hospitals are trying to figure out, can I care for that next level acuity patient?
Or am I having to transfer them out?
Yes. And I mean, you think about that in behavioral health as well. You see throughout the country, there are pockets where patients are waiting or getting boarded in the emergency room for days because there's not an inpatient bed to take them. It's just not a good healing environment. And you can put yourself into the shoes of that patient or their loved one, and the desperation that you feel of how can I get actual care for myself or for my family member when they're in this crisis. I know it's not happening here in the emergency room. I talked with a physician last week that said they had opened a new hospital in an urban center, and within hours of opening, they had expanded all these beds. They were already having patients again in the hallway. And so, they had all these hopes. We're adding beds. We're adding capacity.
We're not going to be full the first day.
And they were full. So it almost feels like we have an insatiable appetite for healthcare, and it's, how to get smart at how to bring that. I think telehealth is a huge part of that solution, because hopefully we can be smart and both collaborating with a primary care physician who can serve as that quarterback for all of the healthcare and kind of bring in the specialists as needed and be really efficient with that expertise. I also think we can make sure that patients aren't having to travel to get that care, or often not travel and not get that care. And so you can treat a condition more effectively in its early stages rather than letting it advance to a point where it's very complex.
Yeah. Oh, that's amazing.